Hello friends, with the next and the most awaited video on countdown to the baby. How do you recognize the signs of labor and when should you reach the hospital? So as you approach the final days of your pregnancy, it's important that you recognize the signs of labor and know when it is time to reach the hospital. Let's explore what these signs are so that you are prepared and confident till the big moment arrives. So as the baby comes more down into the pelvis, you experience what we call as lightening, which can happen a few weeks before labor actually begins. So you will feel that your breathing has got much more easier than what it was when the baby was high up, but it can also increase pressure on the bladder, because of which you can have more frequent visits to the washroom. But these are all normal changes. You experience contractions which are regular, more intense, and at regular intervals. So it's tightening of the abdomen which happens at regular intervals are called contractions. You may experience the Braxton Hicks contractions during pregnancy in the third trimester, but in the true labor, these contractions would not go away with rest, and they are very closely spaced as compared to Braxton Hicks contractions, which are very randomly placed. So what is water breaking? The rupture of the amniotic sac with which there is a gush or leak of the fluid around the baby. So you will feel a warm sensation and you will probably feel as if you have peed. But actually the amniotic fluid will continuously leak like you bleed in your periods, and you will be able to pass urine separately so that you do not have the confusion between the two. The third sign is bleeding. So you can get a lot of mucus discharge or discharge mixed with blood, or you can have brownish colored discharge. These are only indicated that the cervix is starting to dilate. This can be a sign of labor, but your labor can still begin in few days or few weeks after the discharge. So any of these three signs is when you should be going to the hospital. Now, regular contractions. You follow a rule where you're getting about contractions every 5 minutes. Each contraction is lasting for about 30 to 60 seconds, and from the last 1 or 2 hours you've been experiencing these regular contractions. This is when you will go to the hospital. So if you have a water break, don't sit at home and monitor whether you're getting any pain or contractions or not. After water leakage, we have about 24 hours to deliver you. So once you have water leakage, if you are not sure about it, you can even wear a pad, walk around the house. If the pad gets completely soaked, that means your water bag has broken. You will need to reach the hospital. Also, if the color of the fluid on the pad is brownish or greenish in color, you need to rush as soon as you can, because it can be a sign of meconium or that the baby has pooped inside. Another sign when you should be going to the hospital if you have decreased or absent fetal movements. As we told in my last video, that whenever you feel that you've counted less than 4 movements after a meal, you need to eat something sweet or listen to loud music. If in spite of that you are not feeling movements for a couple of hours, you need to go to the hospital immediately. So recognizing the signs of labor and knowing when to reach the hospital can ease your anxiety and ensure that you are in a smooth transition to motherhood. So stay in tune with your body, consult your doctor to all your fears and concerns, embrace this incredible journey and get ready to welcome your little one with open arms, mamas.